Hello, my name is Carmen Valdez, and I'm an associate professor in counseling psychology at the University of Wisconsin-Madison. I'm making this video abstract to talk about a paper that was recently published in Family Process entitled Community Responsive Adaptation to Reach and Engage Latino Families Affected by Maternal Depression. My co-authors are Alyssa Ramirez Stege, Elizabeth Martinez, Stephanie DaCosta, and Thomas Chavez. And the goal of the paper is to describe our framework and process of culturally adapting an intervention that was originally developed for low-income African American and white families to immigrant Latino families in the Midwest. And we begin in our paper by presenting a historical context and summary of the cultural adaptation movement and describing prominent models of cultural adaptations, and then presenting our own work, and that was focused on a clinical population within healthcare settings. And because of the specific needs as well as specific engagement or recruitment efforts that are required for a clinical population, we felt that we really needed to make at the center of our adaptation community responsiveness. And that entails both understanding the needs of the local community and acknowledging that every community has a different cultural and social context and trajectory. Secondly, community responsiveness refers to understanding the current socio-political and cultural climate in which families live and that affects their well-being. Also refers to accounting for the preferences and practices of communities in terms of how they participate in services and how they access services. And finally, also building the capacity of existing resources within the community, such as mental health clinics or primary care clinics. So building their capacity to meet the needs of these communities. And so we knew that to do that, we needed to both engage families who were affected by maternal depression, but also engage the community at large, families who are not necessarily affected by maternal depression, but who know well the types of stressors that affect families and that could make them vulnerable within their families, but also within their communities. And we did that by hosting focus groups in the community, by conducting one-on-one interviews with families, getting to know families, visiting them in their homes. And we also engaged other stakeholders that are gatekeepers to the community. So we met with, provided services to, and collaborated with mental health providers throughout our town, as well as physicians and primary care providers, so that we could better understand what services were already available to families and what these services were providing that ours did not provide because we did not want to repeat services. And we also learned about ways to engage this community in collaboration with these partners so that we could reach the families that need the service the most, but also that we could engage them in a way that they felt was respectful of their culture and their preferences. So I hope you will enjoy reading the paper. If you have any questions or comments, please feel free to send me an email that appears at the bottom of the paper. And thank you very much for your attention. Goodbye.